Welcome to another episode of the Rhodes Home Healthcare Podcast. Today we have a special guest in the house, my beautiful sister. It's her birthday today, Chantel Hernandez. Actually, she's one of the founders of the Rhodes Home Healthcare, along with myself and our other brother. But I wanted to bring you on, but you were dealing with the new addition to the family, little baby Celine. How's that going?
Oh, my goodness. Well, thanks for having me. I'm a fan. As being your little sister, I think I've been a fan for quite some time.
Yeah.
Celine is beautiful. Our baby girl, she's such a blessing. Love being a mom. Your niece, soon to be goddaughter next year, we hope.
Thank you for that.
Yeah, and she's what a gift. Last year, I prayed so hard, and here we are celebrating with her today.
Talk to me about they tell you that your life changes as a parent, but when you now are experiencing it, how are you looking at life now versus pre-Celine?
Oh my gosh. The kaleidoscope is completely different.
Yeah.
I get emotional because my life feels so complete. There's nothing that I feel can break my spirit today.
Right.
Waking up today was such a gift. Feeding her, giving her bottle, even though I was so tired because my husband and I had a glass of wine last night.
Yeah.
And it was
You sure
the
you didn't have the
best.
bottle?
We did. Sorry, not sorry.
Yeah.
But it was, pre 40 night, and we had some pizza, and I just kept thanking God, like the simple things in life taste so much sweeter now with her.
Right.
Just going up to see her after I put her down to sleep, and then waking up excited to give her milk, and seeing her this morning for my birthday. It was just unbelievable.
Yeah.
It was beautiful.
The biggest thing that they bring in, Emma's birthday was yesterday.
Yeah.
And looking back at the pictures that you posted and everybody posted.
Yeah. That's another
And I
one.
cried about 4 times yesterday. I'm not even going to lie. I
Yeah.
caught myself in my office at
Yeah.
home. I worked from home on purpose because I wanted to be around her
Good.
yesterday.
Good.
And
She's such a blessing in our life.
I
Love her.
just caught myself crying
Yeah.
out of nowhere.
Yeah.
And I'm like, why am I crying?
Yeah.
Because I keep thinking about what the next 10 years are going to look like.
Right.
And she's going to be 20. She's probably going to go away for college, knowing my daughter.
Oh.
She's not going to be
Emma.
anywhere near us.
No. She'll
And
be exploring the world.
She'll be exploring the world. And I just started thinking about what the house is going to feel like without her in the house. So
Enjoy every moment.
yeah, I do.
Because she's a handful, but we love Emma.
Love her to death.
Yeah.
And I love Mila too as well.
Of
But,
course.
your
Yeah.
first one's your first one.
Yeah.
You
We
know.
felt the emotion, so Mandy and I we were thinking how you guys must be feeling, and we're
Yes.
the aunts and uncles from the side.
Yeah.
So it was I can imagine how you're feeling. I
Yeah.
have your picture when you first held her.
Yeah. Amazing.
I went down memory lane.
Your
and
purpose changes when you have children.
That's right.
And I always told you this. We had conversations and
Yeah.
I said your purpose is going to change once you have a child. You're going to see life a
Different.
lot more different. And
Yeah.
that's the special thing about having kids. And that's why I'm a big proponent of people having kids. And, I know some of you younger people are not having these conversations, and you shouldn't. Like, I think there's a progression to get there. But I think you should really consider having kids because it will change your life. It gives you purpose. And it's what you're going to leave behind to this world.
I agree.
Yeah.
I agree. It's very scary, I think, at first, but once you realize the tenderness and the love that you're receiving, just that alone is priceless. There's no explanation. You just have to really walk it and live it. And until you do, I don't think
Right.
you can appreciate that.
Right.
So thanks for that advice, because between you and our other brother, I was told various times.
Yeah. Being
Wait
told
till
and
you be-
experiencing are two different things.
I agree,
Yeah.
but that's why I'm saying and
Yeah.
admitting it, that you guys are right.
Yeah.
Mm.
Well, thank you for being humble enough to
Yeah.
say that. But
Yeah.
all right, so let's talk about how do we get here today with the
Hmm.
Rhodes Home Healthcare. Let's just talk about our journey in this business. It's been 22 years that we've been at this.
My first baby.
Yeah,
That's what it feels like.
the first baby. But talk about your story, because it's our story, right? We
Right.
grew up together.
Mhm.
We had a sick mother. She needed home health. She received home health, and thank God for home health,
Amen.
because we wouldn't be here today. I think it gave us a lot of flexibility to be able to do some of the things that we've done, and more you than me, because you were more heavily involved with mom's care than
Yeah.
I was. I was out doing my thing. We're
Yeah.
3 years separated, but I ended up leaving the house, and you had to endure a lot of that you know, last part of mom's life, and home health played a big part
Yeah.
into that. So
I never imagined in a million years that I would have done home health ever, or that I would be as dedicated or passionate about the elderly ever. But as life progressed and the calling to grow, I realized that this is so much bigger than me, and I didn't realize that until after maybe I paid some debt off. That I realized, wow, this is so much bigger than me, and it was really God telling me and connecting the dots in my life. Like, this didn't happen for you like this didn't happen on purpose. This happened for you to have a purpose.
Mm-hmm.
And so I look back because I always thought I was gonna when I left when I graduated from high school, that I was gonna do something with human resources and grow some company as far as psychologically. I had that type of mindset, and that's actually how I started in home health. You bringing me along after a HR staffing company that I worked for, Placement Pros.
I brought you to an office manager, right? At
No,
AMNA.
human resources.
Oh, human resources
It's
at
like,
AMNA.
hey, there's an opportunity for you at this home health company that I'm
Yeah.
working with, and I'm like, I don't want to work with family.
Right.
Definitely not. And you're like, but look, you're not really gonna work with me. You're gonna work in try to interview and get the money because we really needed we really
Right.
financially needed.
It was like $20 an hour at that time.
No, I skyrocketed from like $12 to 16. I was like in my
It
mind
wasn't 20.
at the time, maybe.
I think it was 20
It felt
bucks.
like that type of
Yeah.
shift. I don't remember, but I
Yeah.
know that I it was like $4 or $5, significant change.
Right.
So I said, sure, I'll go. Fine, as long as I'm not talking to Andy, I'll go work for the same company. It's fine. So I started there, and HR. I really revamped the department. I remember, and I had an assistant. I grew, and then I left for other reasons there, not to mention. And I called our brother, and I said, hey, I want to go work with you now in Broward. And he's like, well, Chantel, you're gonna have to go through an interview process like everybody else. And I'm like, fine, I just get me out of here. Like, I'll do it. I'm interested in a new opportunity, and I want to grow. He's like, all right, we'll go interview with Mr. Sheldon and Kavana. May her soul rest in peace. And I interviewed with them actually here in Hollandale, and I wore a sunflower dress, so I thought it was appropriate.
I remember the sunflower dress.
Yeah. My lucky sunflower dress at the time, and I figured, why not bring out the citrus,
Sure.
the sunshine colors today. And I interviewed, and I got the job, and I started from the bottom. And I started actually as a receptionist, and I did intake, then I did human resources, and I did all the clerical positions, and then slowly but surely, payroll, case management, overseeing that. I oversaw like 7 branches at that time while I was caregiving for mom. That's why this is so integral of how God connected the dots in my life, because I graduated from high school. I went to TCC, Tallahassee Community College, in seek of financial freedom, to be honest, because we could not afford college or anything like that. And Tallahassee was offering me a good chunk to send back home to mom, and all the things that we would try to come up with to sustain a home at such a young age. So when I came back home, I started working at the DME company with Z, but then, which is our brother Z. And then I left to the staffing company, and then I came back. And my point to this was, my gosh, I just drew a blank.
You used to have pregnant brain?
Yeah, I do. I do have pregnant brain.
Yeah, how you evolved in the business.
Oh, so I ended up leaving that company because, again, I wanted more money, and then I left. And then I decided, you know what, I'm going to take the plunge again, and I'm going to go back. And I did. And then the rest is kind of history. I started to work in total home health, and that was the best experience I could have ever had. I was mentored by the best of the best, from Stephen Lestumbo to Kavana, like I mentioned earlier, to Mr. Leo, Sheldon, Sophie Lavisier, the
Sophie.
best. The best in
That's
the
a
game.
name from the back.
Yeah, back in the day. Here in Broward County, that is. And I was very privileged to be exposed so young in the home
From the
health.
past is what I'm looking
Yeah, to be exposed to home health while at home receiving home health care for mom.
Right.
So that home health aid was my saving grace, because I would drive from West Kendall to Hollandale or Miami Lakes or Miami Gardens, And then I would go to FIU, and then I'd come home and make sure everything was good with mom. But I always would be on the phone with the HHA or the CNA. And like I mentioned in one of your posts, LifeLock. LifeLock was huge for
Yeah.
me. I paid that bill happily because God forbid anything happened to mom and she would fall, she would press the alarm
It
and
was Lifeline, no?
life, life alert,
Life Alert. You
life alert.
say I thought you said LifeLock. Life Alert.
Did I say LifeLock?
Yeah, you said LifeLock. Yeah, that's for the credit.
Oh my God. Could tell
It's okay. It's
Oops.
okay. Life
Yeah,
Alert.
life alert.
Yes.
Life alert.
Yes. I remember she used to have it.
Yeah.
She used to wear
A
it.
necklace around
Yeah,
her.
necklace. Yeah, I
Yeah,
remember
and
that.
that was saving grace because if she was able to do that, then I knew that she was okay,
Right.
but it was still very scary. And so I would decide whether the ambulance would go or I'd call the neighbor.
Mm-hmm.
Ricardo
Mm-hmm.
también, may his soul rest in peace. And we had wonderful neighbors growing up. I gotta say that. I really do. They were integral part in our sanity.
Right.
Because having a loved one falling and not being able to get up, which is the hardest part. 'Cause
100%.
mom couldn't get up because she was limp after her stroke of my birth, and so that was the hardest part because you would see mom, but she didn't look sick.
Right.
So it was more of a physical attribute that you would notice on mom, but then you realize later, her trauma, and then you learned later that she had the aneurysm and she was dealing with that and the seizures and the TIAs. Basically, every week I was
That
going
was a
through
lot.
something. I was
That's a
driving.
lot.
I remember so many times just driving from Hollandale home, rushing to get to her to make sure that she was okay, that she didn't have a seizure or stroke while she was on the floor, which was my biggest fear. Um, I remember trying to reach sometimes the CNA to see if she would check on her, and she would go. She was the biggest part of mom's care,
Yeah.
and that's why I'm so grateful to our staff, and I pray for them deeply because sometimes you have to be so selfless to help them,
100%.
and us being so young, you don't realize how selfish you are at the time,
Mm-hmm.
and you think your mom's okay because you're like in denial.
Yeah.
Especially, I was so young. You
Mm-hmm.
too. We were
Mm-hmm.
just so young.
Mm-hmm.
We would do, I would say, a lot of reckless things too. Staying out, partying is what it is. But we had a lot to juggle, with taking care of mom. So I think like our outway to just kind of decompress from it all was to be the life of the parties. Because I'm sure people watching are like these two. Here's my halo.
Yeah.
But we are grateful that mom supported all that, and then she was supported by home health. So it was young kids figuring out their lives,
Yeah. Taking care of a sick parent.
taking care of a sick mom,
Yeah.
and juggling life as we know it with taxes and bills and things. And my heart goes out to caregivers today because, I mean, and especially the kids, the young ones, when I do deal with them, because there's no instruction book on that.
Right.
It's
Right.
just,
One of the things we talk about here, we've talked about, in the assisted living podcast and the roads, like you get hit out of left field and you have no idea it's coming. With mom, she was sick since we were kids.
Yeah.
You were born, I was 3.
yeah.
So we dealt with that our whole entire life. But a lot of these situations happen from one day to the next, and it
Yeah.
changes their life from one day to the next. And I think there's not enough education out there for these families, and it's a tsunami that
Agreed.
comes. So what advice do you have with somebody that's experiencing this for the first time and they don't know where to turn?
Well, thankfully we're here and we're exposing ourselves on social media, because other than that, I don't see a place that's really going to guide you or tell you, hey, call these guys or call so and so to
Sure.
assist you with this new phase in your life.
Mm-hmm.
So that's where we come in, and we really have to be out there in the community educating others so that they know that there is that availability. We don't just post on social media for business. It's more about being a resources to others and serving them by letting them know that we know a little bit about this industry, so we're
Sure.
gonna guide you as best as possible. I mean, that's where having good relationships in our community is so important,
Mm-hmm.
so that people can trust you with their patients,
Right.
especially those very delicate cases, from the cancer institutes that we work with, various, types of cases. But having that knowledge really, really does make a difference.
Absolutely. Yeah, I just think the more we speak on these issues, and we've experienced it, that's why I tell people all the time, like, we have lived what they're going through day in and day out,
Right.
and we understand. And
To a degree.
Yeah.
We're still blessed, you know.
We are. We are.
'Cause
And
we
there's situations and cases that are worse than what we went through. Even though our situation, I would think, is tough, being little
was.
kids
Yeah.
with a sick parent,
It was.
not having a father at home. I
It
mean,
was.
it was tough stuff. I
Yeah.
mean,
But
looking
we're
back on
tough.
it now, yeah, we are tough.
That's why, to me, when I look at other cases, I'm like, wow, we were tough. But,
Yeah.
you know, we were blessed too. We
Yeah.
were, you know,
It goes back to the point of the neighbors, but I remember the Susana Monroes. I remember the Luis Diaz. I remember the Tony Rodriguez's, which Tony's is my father.
Yeah.
I remember these people. It took a village to help us,
Absolutely.
to get us to where we're at today,
Yeah.
and we can't forget that ever.
No.
But
And our
the
teachers.
teachers, well,
There were good teachers we had that looked out for us too.
yeah, yeah.
Very good teachers.
I don't remember. I don't
My
remember
teachers
much
loved
about
me.
Yeah, I don't know. They didn't love me.
I don't think that's true. I think you just didn't care to hear the compliments, but
Yeah, maybe.
I don't know.
Maybe. That's a whole different podcast.
Anyways.
So yeah, I think it takes a village, and I feel bad for a lot of these families because, man, their world gets flipped upside down. It starts affecting their
Everyone.
marriage. It starts affecting their work. It
Life.
starts affecting everything that possibly can get affected. Gets affected when you have to care for somebody that's sick. And the point of this podcast is to really educate people that they're not alone.
Yeah.
They can reach out. We have been through it as people, and we understand as a company that we can be that support that you need
Absolutely.
when you're going through some of these hardest moments that you're going through.
It's like having a baby almost.
Yeah.
Again, but in a different stage of life.
Mhm.
And now I can understand that better than ever, having an infant and then caring for someone.
Right.
But when I hear the stories of really, you know, mom passed very young, 60. But when you're dealing, after 75, it's a whole nother ball game.
Ball game, yeah.
And I see it with our godmother,
Mm-hmm.
who lives alone, who I
Yes.
worry about tremendously because she's alone.
Yeah.
And I think about all the
She's
other
such a
caregivers.
gangster.
She is a gangster. Oof, our godmother
Yeah,
is
Madrina,
something else.
Luisa.
Madrina, I love her. I sent her a message this morning, but she's alone. She's like, déjame en paz. And, you know, there's so many of them that still want to drive to Walgreens because they don't have anybody actually. I try to do my best, but now I moved. So when I lived closer to her, I would do my best to do what I could for her. But even then, taking away the keys from her is not that easy.
Right.
They don't want that.
They don't want that.
So it's difficult.
I had to help a guy out the other day,
Yeah.
an older guy. He's probably in his mid to late 80s.
Mm-hmm.
He goes to the bakery every morning, at Cal Bakery, and I
Mhm.
happen to be there, and I see him struggling to get out of the car. He's
Mhm.
hunchbacked,
Yeah,
and I'm like, how is he driving?
yeah, same.
And I
here.
had to help him get back in the car,
Yeah.
and I'm like, should I even let him drive?
Right.
This is like, I'm wrestling with this.
Yeah.
And he goes, no, yo estoy bien, blah, blah. I go, where do you live by? He goes, well, I live across the street. I said, okay. All right.
Maybe I'll follow him.
He's going to get out of here. He's just going to go across the street. Okay, he's going to get there. Right? But I was just playing through my
Yeah.
mind. It's like, do I let this
What
guy
if-
even get back in the car?
Right. And
And like him, how many people?
so many, too many, to be honest. And I
Yeah.
see it every day. And then I think about our friends with teenage kids driving now,
Yeah.
and then that controversy. And then
Yeah.
I'm like, oh my gosh, the independent, then the not. How do you
Yeah.
take away these keys? So I think it's a matter of time of addressing it. You know, with her, the funny thing is, I think about 2 years ago, she lost her keys.
Mm.
So then I started to just kind of plant seeds in her and say, well, how would you feel if you don't drive? And she would get all restless. Like, she was like, oh, no, a mí no me va a
Well, they
quitar
want
la
their
llave.
independence, right? It's part of their
Right, and I had to
dignity.
take away my keys, you know, like, I want to drive. I can still drive. I'm fine. Look. And she would do exercise moves and kick her
Yeah.
leg. And she's like, I'm fine. And then when she met the baby this year, she's like, you see, I'm fine. Like, she picked up the baby. She didn't drive to my house. I picked her up, but she still goes to Walgreens. She still goes to Publix. And then I asked her, tú sigues manejando, tú vienes para mi casa. You're going to come to the house? And she goes, no, that's too far.
Right.
So I think what
She's starting to scale back.
yeah, and I think what happens when the family is slowly starting to show, you know, you really shouldn't be driving, you know, kind of not to scare them, but like your vision, you know, you need to be careful with your vision. There's other people driving. If their back hurts or whatever, kind of like point it out, not to make them feel worse,
Right.
but you shouldn't be driving, you
Yeah.
know, and you just kind of plant that, and little by little, I think they start to let go because they realize,
Sure.
I am tired.
Yeah, of
I'm
course.
tired. So
I think it's all how you position it, how you have a
Right.
conversation. If you try to do it drastically right
Yeah.
off the bat, you're going to have a big problem.
absolutely.
Yeah, I think it's a slow progression in the conversation.
Maybe you can lose the keys for them, you know, hide them. That you know,
Truth be told,
yeah, you went through.
Yeah,
Yeah.
we went through it. We had to remove a car from the family.
Yeah.
And I thought about stealing the car in the middle of the night.
Yeah, yeah, we had to tell her to stop driving.
Yeah,
That was
so I
hard.
had the keys. We had the extra keys. But
Because of the medication, though.
yeah.
That's another story,
Yeah,
though, not because of age.
so he got into a little fender bender, and we took the opportunity to take the
So,
car from him there.
yeah.
Shouldn't be driving, and the problem is not him.
Our
The problem
neighbor?
is no.
What are you talking about?
I don't want to say because I don't want to put our stuff out there like that.
Oh, I know who.
Yeah,
I know who. Okay,
Yeah.
got it.
Yeah.
Yes, I know exactly who you're talking about. Yeah,
Yeah.
you had to do what you had to do.
yes,
Yeah.
yeah. So we did it. Thank God it worked out because we were praying because
Yeah.
it was going to be a tough conversation, but he ended up getting a little fender bender.
Right. And
We-
then he surrendered.
Yeah,
I
he surrendered
remember.
the car.
Yeah.
So
But
I
see,
was,
the big guy knows.
yeah, I was very happy about that. But yeah, it's tough because they want to be independent.
But we did go through that with mom.
We did as well.
We had to take away the keys. I'm like,
Yeah.
tú no puedes manejar.
I remember.
That's when I started to drive illegally. I
Yep.
mean, illegal.
Yeah,
With a restricted
sure.
in the Honda Accord,
Yep.
the 1996 with
Yep.
mom in the car,
Yep.
because you couldn't drive anymore.
Right.
Remember that car?
Mm-hmm.
Then we managed,
Right.
but that's actually how I started marketing because I needed to take her more
Right.
to more appointments. Obviously, better car condition then, but I learned to drive that way because she had to stop driving.
Got it.
So
Yeah.
you know,
Yeah, it's tough stuff, man. There's not, like you said, there's no manual for any of this stuff. Let's talk about the evolution of home health from when you started to where it is at today, and how it's night and day from when we first started to what it is today.
should I get my book? I'm just kidding. You know, little burn book. You know, like that movie Mean Girls. No,
Yeah.
I'm just kidding. Listen, it's evolved tremendously, and I'm glad that it's cleaned up. Like Medicare's cleaned up. You know,
Here at least.
at least in Florida. This is
Yeah.
very much no California.
Right.
This is definitely streamlined in a way that if you're prestigious enough and you're following guidelines and you're really working well with your providers, you're going to be one of the ones that stand. But this business is it's not for no rookie. I'll tell you that. These days, you don't know what you're doing or where you're standing. Good luck. You
Good
just
luck,
might as well go broke
Yep.
because things are not like they used to be. And I like that Medicare has stepped up the leverage because then we have to excel up as an organization, and we have just as we have as individuals, right? But things have just changed so much for the better. I mean, now everything's electronic. Telehealth was big, even though now it's been taken away. With COVID, we learned a lot. So let's talk about the positive on that because we realized that there's so much more an agency can do virtually. And now today with AI and everything that's coming aboard, coming about, we're so amped to see how those changes are gonna help our patients' satisfaction because now the nurses are gonna have less paperwork or whatever. They could just like digitally voicemail it. I mean, write their notes or whatnot, and you have more focus on patient care versus.
Yeah, I think that's
huge.
That's the encouraging
think that's
part. I
big.
still think there's a lot of red tape when it comes to our business, and it causes a lot of challenges
Right.
for us. There's a lot of variables that need to happen to be able to bill a case today,
Right,
and it
right.
depends too much on the doctor's hands
That too.
in order for us to, have cash flow, right?
Right.
Like, cash flow is a big issue in this
Yeah,
business,
huge.
and people, you're seeing businesses go out of business or they're selling because they can't withstand what goes on with this because our life depends on these doctors signing our orders. And when
Yeah.
you're working with hundreds of doctors, we're not working with one or two doctors.
No.
This is hundreds of doctors throughout our whole entire state of Florida.
That's right.
It's tough to pin down a doctor. They're getting hit from everywhere, from labs, this, that, the other, hospice, and they got to sign so many things. So imagine it's just one more added thing.
Right.
And to them, they have no incentive of signing. Yeah, I know that they can bill for the POC, but they don't want to bill because they don't want to cause a red flag for themselves.
Exactly.
Like, and that's the conversations that we've been having for years. So is how do we streamline this thing to be able to? And I agree with all the regulation when it comes from a compliance standpoint, anti-kickback standpoint. But when it comes to the flexibility of the business being able to run and operate from a cash flow standpoint, they need to do better.
They have.
They need to
I
do
agree.
better because it impacts
Yes.
the agencies that do the right thing,
Right.
and it impacts the patient care.
Right.
Believe it or
Because
not.
it's already been paid out.
Yeah, like it impacts the patient care, and you can provide more if you had better cash flow because you're really spinning your wheels trying to
Right.
figure this out. I do have the hope now with AI
Right.
that a lot of this stuff is going to get improved
Right.
because it takes a lot of labor right now
Yes.
to be able to run a home health agency.
Yep.
But with AI, I think that's going to change,
Right.
and I think there's going to be a lot of improvement for the business. And it gives me a lot of
Yes.
optimism for
Yes.
the business. The other thing that gives me a lot of optimism is, by 2030, you're going to have 80 million Americans that are going to be over 65 and over, right?
Baby
They're
boomers.
they're going to need, exactly, the silver tsunami they call it. They're going to need care. And where do they want to get treated? They want to get treated at home.
Right.
They don't want to be in a hospital. They don't
Right.
want to be in an institution. They don't want to be in an assisted living facility.
Mm-hmm.
They want to be at
Home.
home. So
Mm-hmm.
I think we play a significant part in that care, but the rules gotta get a little bit better in the standpoint of how we operate, and get our cash flow, because they've made it nearly impossible to stay cash flow positive in this business right now.
I
And I
agree.
think it's been on purpose,
Oh, well, that was my point.
Yeah.
I was just about to say, well,
because they want to
the
get a lot of people
control.
out of the business,
It is, and
right? They
it's
wanted the bigger
yeah,
players to come in.
absolutely.
But here's the problem with the bigger players. You have so many layers to these companies that at the ground level, where it truly matters of taking care of these patients, they don't provide the same care we provide.
No, that's the difference.
That's the difference.
But they don't understand that because
Right.
it's about culture,
Right.
and that's when they get run out.
Yep.
And they don't make it.
Everybody's
and
a
they don't
number in
make it,
these businesses.
and
Yeah.
they don't make it because at the end of the day, it's a balance between both.
Yep.
So you have to have the capital, you have to have the knowledge, but yet you need to have the culture to understand how to run in Florida,
Right.
because you can come from another state, which we're seeing. I'm hearing stories right now with a current agency, a big company that bought out another smaller company that was doing
No, but
fairly
this is a
well.
culture shock.
It's a culture shock.
Come here,
And they
good
want to
luck.
micromanage.
Right.
And the reality is that you can't micromanage home health. We're not a hospital still. We work with this hospital. We are an extension to the hospital, but we're not a hospital. So they have to keep that in mind, these big dogs that want to just try to, and that's also, I think, the Medicare perspective. Like, they want to try to capitalize. So they're trying to take away the smaller businesses as much as they can. So finally it can just be like only a few.
A
And then
set amount,
eventually
yeah.
I don't know, but it's like a control. Eventually, like, it just feels like they want to have a control. So it's like building a portfolio, letting it grow as the United States gets to that level. And then once I think it booms, that's when we're going to see another change. I don't know. Just 22 years, 20 years in this.
Yeah, we've seen so many changes in
You see so
this.
many things that I would not be surprised. But then again,
I just the only concern that I have is the advocacy. The last 15 years has been totally against being pro us.
right.
The advocacy is they're making too much money, or they're a bunch of fraudsters. All that stuff. And listen, and what's happened in California
Yeah.
with Nick Shirley,
Yeah.
that's a whole set of different things. But here I can tell you, in the state of Florida, the feds came in here and they've cleaned out a lot.
Clean house. You can't
They clean
afford-
house.
You can't do none of that.
No, none
anymore.
of here. Like,
And yeah.
the review choice demonstration. It's only in 8 states, and out of those 8 states, 7 are Republican. The other
Well,
ones,
no.
yeah.
Mhm.
Like, and
Makes
I'm,
sense.
I'm not
Yeah.
going into the politics side of
Right,
things,
but-
but it's very obvious, right, that the ones that are on the blue side are not going through the same regulations
Right,
that we're
we
going
are.
through.
Exactly.
And usually Democrats are more regulated than Republicans, but here in this state,
Yeah.
like, it's tough to do business here. You're
Right.
being completely watched on everything that you're doing.
You're under a magnifying glass.
Yeah.
And we've lived it. We've experienced it between survey, ACA, all the things. And so once you live it and you experience it and you add culture, you
Yeah.
kind of get to where that point where you're able to be in 14 counties because you understand the beast
Right.
of what home health takes.
Right.
But other than that, good luck.
Right.
Because reality is that home health is savage. It's very much savage. And there's no other way to portray it. It may look a certain way, but to get paid, to build that claim, to get the patient service, to pay the staff, to make sure your reps are happy, to make sure your case managers are happy. I mean, it's an ongoing snowball of responsibility that I hear as your sister, not only as your business partner, but as your sister. That I'm like, wow, God. I mean, we're still here. Clearly, this is a purpose, because to come up with a payroll that and I
That's
don't even like to get into this, but
Right.
nobody really knows. Nobody,
Right.
we don't really talk about none of this stuff. This is
Mhm.
why this is why you built this podcast.
Right.
And you told me about building this podcast when we did Tony Robbins years
Right.
ago. So it's very exciting to be here. But what I'm trying to get to is what we want to portray here and share with everybody is this is not easy. This rodeo is not easy. this, it may seem easy. We're here talking on a podcast, but
Oh, it's been a lot of sleepless nights. People have no
yeah,
idea to
um,
try to make this train. And I tell people we don't have entry level positions in this company.
right,
Maybe we have one or two. The rest get paid very, very well. You have educated people that have
that's
licenses,
right,
degrees,
that's
certificates,
right.
whatever you want. Even the HHAs are making significant amount of money versus what it was before because the market calls for that right now. But the problem is that they keep reducing our margins and they keep cutting our cash flow.
Right.
It creates a bigger problem and it creates a lot of sleepless nights for yours truly.
That's right. And a lot of loans.
Yeah.
And a lot of things that we have to pay off.
Yeah.
And yeah, where do you get that equity from? How do you do all, and that's as a business owner, I'm happy to see you flourishing and offering your expertise to others.
Yeah.
Because I see you now like on the Andy Hernandez show.
Yeah.
And I know it's from the experience that you have gained from the roads.
Yeah.
And it's valid to point that out because I get asked, well, how's Andy doing it all, And it's like, well, I don't really get into it, but I'm like, he's doing it by the grace of God. And it's really just the experience that you're getting on hands on every day with everything. It just life is.
So I want to
throwing at
answer this
you.
question for the people that have that question. For me, there's 24 hours in a day. There's 16 hours in a day, and I take the most efficiency out of those 16 hours. I'm very efficient with my time, and I've gotten better over the years. I've never used to be like this.
Yeah.
I am very efficient with my time. So if I'm not working, I'm with my family, or I'm working. That's it. I'm not watching Netflix. I'm not hanging out. I'm not doing any of that.
Well, we can't afford it.
Huh?
We can't afford it.
No, I am constantly working or I'm with my family, and it's not cap as the young people say. It is the truth. I'll
is
stay
cap?
lie.
What cap?
Lying, yeah, is cap.
Okay.
You don't know what capping is?
I know what cooking
There's
is.
no lie in what I'm saying.
We
Like,
be cooking, not capping.
but there's no cap in what I'm
Yeah.
saying. Like, it is the reality. Like, if you can ask my wife, I am up to midnight. Last night's the first night that I watched TV that I watched the Knicks game.
Yeah.
Right? The other day I watched the Knicks game, but I was networking, working. Right? I if it doesn't bring value to my life, I'm not doing it, and that's how I can do all of it. I think anybody can do it. I know we're talking about podcasting, but I think there's a bigger thing to answer here is that be more efficient with your time. I promise you have the hours in the day. But anyways,
Absolutely. And I'm here to support it.
yeah,
It's better. We could see what you're doing. It's not like we can't see.
you're right.
You're on there 24/7, so
Yeah.
we see what you're doing. But it wouldn't be possible if it wasn't for structure, if it wasn't for being able to have grown with an organization that's made us grow. Period. We have
Right.
no other choice,
Right.
but as we just slowly shared with you guys about our payroll, right? Like we have to come up with creative ways, especially Andy, to pay us all.
Yeah.
So thanks, and to all the organizations, to everybody at the Roads Home Healthcare that makes things possible for everybody to be serviced, not just from our patient standpoint, but from our field staff.
Yeah.
To everybody that's involved in the Roads culture. This is no joke, and we're so grateful.
I want to give a shout out to our team
Please do.
because they're the ones that make the
Yeah.
magic happen every single day.
That's right.
From our clinicians, our executive directors, our corporate team,
That's right.
Leo, Grace, Vivian, Ruman, Brooke, everybody that's on our team, man.
Everybody.
I love everybody.
Millie,
Millie, Jackie that's been with
Jackie,
us for so
Sweet,
long.
Everybody, all the case managers,
Sharon
everybody.
On the West Coast.
Yeah, Southwest Florida. Yeah.
Southwest Florida. Miss Daisy now that she's
They're
taking
doing
over the
great.
steward office.
Southwest Florida's now 5-star.
Yeah, 5-star.
Poof.
Yeah, incredible.
That's phenomenal
Yeah.
for us to even.
Yeah, and Broward is
celebrate
4.5
that.
star now too.
Oh wow,
Yeah.
that's amazing.
Yeah, so we're working. We've been really working behind the scenes. I'm
So
trying to
proud.
improve our outcomes. So it takes a lot, man. It takes a village to do this. And again,
It
I want
does.
to thank our team
Yeah.
that's been behind us all these years
Yeah.
and the people that have come through
That's
here
right.
and that have helped us.
Yeah, I just had a few people pop
Yeah.
up that are no longer with us, but we're grateful.
The Barbie
to you.
Matos
Yeah,
of the world,
yeah.
she helped us tremendously.
Yeah.
I can just go on the list of people that have come through here.
Yeah.
That they
Contributed.
impacted. They
Yeah.
impacted to what we are today.
That's right, and
Yeah.
we're forever grateful, as I like to say.
Yeah, yeah.
And today is, today is Thankful Thursday. Haha.
Yeah, your birthday.
So yeah, and my 40th birthday, and officially 20 years basically that I've been in the industry.
That's
so what
crazy.
better day than
Right,
today?
than today. That's why I said we should do it on your birthday.
Than to come and talk a little bit about this
Yeah.
and just say thanks.
Yeah.
And I think that our culture really does stem from what we've been through.
Yeah.
And the biggest shout out that I want to give today is to our mom
Yes.
in
Amen.
heaven.
Yes.
None of this would have ever been possible without the love and heart of hers that she had on us,
Yeah.
and the purpose that she had in our life.
Yeah.
we wouldn't be so compassionate today if it weren't for her. Ah, miss her, and I love her so much.
Been thinking about her a lot lately.
Yeah,
Yeah. You
and
know,
she'd be so proud of you and me, and happy that I'm finally a mom and we're here today.
Yep.
And she sees you, man. She sees you every
thank
time
you.
you're going through it, and I know she's your the biggest guardian angel we have, and we'll just keep moving forward. She loved us all so much, you know. So proud, so proud of us, no matter what we did. And I think that's why all this is so possible today because
Right.
the love we had from our mom.
Absolutely.
And a big shout out.
Yeah, I
Te
just
amamos, mami.
I miss her. I miss her.
Yeah.
You know, every day I think about her.
Me too.
Any parting words? Anything you want to
Just,
share other
I'm
than
just so grateful.
Yeah.
I'm just so grateful to God. I'm grateful that we get to serve this amazing population that
Mhm.
have served us, the younger generation, right? It's like so ironic that we get to do this now. And we didn't even have grandparents growing
Yeah.
up, which is a whole nother podcast.
Yeah.
But we didn't. And we just came from a place of this is who we are and this is what we've been through, what we've lived, and we're gonna give it our 150% because we have no other choice. And then it became purpose. You know?
It is purpose driven, and I look back, you know, the 22 years that I've been in the, you know, industry. I've been in healthcare for 22, 20 in home health, I think, right?
Mhm.
No, 21 in home health. Wow, 23 in the healthcare industry. I gotta
Right.
gotta
I
change that
started in
because the
2007.
time keeps passing, but I'm not changing the years with it.
Yeah.
You know what
yeah,
I mean?
I hear you. I hear you.
Yeah. So
Yeah, I started home health 2007.
I look back and I'm like, man, God just grabbed us and
Yeah,
put us in
boom.
this industry without even knowing why. You know, and that was for other reasons, right? But the reason's bigger than us, and we're impacting a lot of
That's
people's
right.
lives, and people truly need us, and
That's
that's
true.
the purpose of all this. So, thank you for coming on.
Thank
Happy
you.
birthday! I
Thank
just
you.
have to say that I'm proud of you. I'm proud of how far you've
Likewise.
come. You've
Thank
been a
you.
big part of what we've been able to build.
Thank you.
Don't ever forget that.
Very proud.
Without you, none of this is possible. So I just want to give you your flowers as well.
Mm.
And yeah, man, I'm happy to see. I got one question.
Mm.
Are we gonna have another one?
Oh, I want one, but my let's see, let's see.
Is it in the cards?
I
I'm all-
hope.
I'm all
You
for
know,
it.
we'll see. We'll
I'm
see.
all for it.
We're now on the 4th level, so
Right.
you know, whatever the
It goes through the progression. When we first
Yeah.
had Emma, we 2 years we were like, we don't want another one, and then like that
Yeah,
25th month came around, we're like, this is not so bad,
right.
and we had
It's
another
for my
one,
husband.
and then we did it again. Yeah, but I was there too.
Yeah,
It changes.
hopefully.
You know the joy that I've seen in Manny, I've never seen.
Right. It's so true, babe.
So,
Sorry.
so you know, it's good to see that he's really happy.
Yeah.
And he's really enjoying fatherhood,
is.
and it's only
He's
going to
a
get better,
great
Manny.
dad.
I told you this the other day. When she starts reacting to you, understanding who you are, your life is really going to change. You think it's changed now,
No,
and it's
wait.
changed in the physical and how you have to operate every single day. But wait till she touches your heart for real, and you're going to know what fatherhood is really about.
So excited.
Anyways, check us out. Like, share, subscribe, comment. Share this with anybody that's going through it right now when it comes to their patient care with their family member or going through a hard moment. You know, we've lived it. We've been there. And, you know, you can reach out to us on Instagram, DM us. We would love to see if we can help you in however way we possibly can. So thank you guys for tuning in.
Thank you.
We'll definitely catch you guys on the next one.
Sweet. Bye-bye.